Welcome back to Scaria.com. My name is Muhammad Osama, and today we are discussing the vascular system and its pathologies. And in this part of the lecture on vascular system, we are going to talk about the venous disorders and the tumors of the vascular system, including both benign and malignant tumors. So let's start off with the venous disorders, and let's start off with the venous thrombosis. So venous thrombosis is actually the formation of the thrombus in the veins, most often in the deep veins of the lower extremities. That is why it is also commonly known as deep venous thrombosis or DVT. It is predisposed by venous circulatory stasis, which means impairment in the circulation or the flow of blood in the veins, or because of the partially obstructed venous return, such as with cardiac failure in pregnancy, prolonged bed rest, for example, after surgical procedure, or varicose veins as well, which is also a venous disorder, which we are going to look into the detail as well. But it is also often associated with inflammation of the veins, also known as thrombophlebitis. So as you can see here, it is an example of DVT in which lower extremity veins are involved. And you can see this is the normal blood flow in the vein, in which there is blood flowing against the gravity, and there are these valves which are actually preventing the backflow of the blood in the veins. But what happens in deep venous thrombosis, that a blood clot or a thrombus forms around the valve, and this results in backflow of the blood and thus impaired circulation. The second common venous disorder is the varicose vein, which is actually the abnormally dilated and tortuous veins, which means tortuous means not like having a lot of twists and turns. And they are most often superficial veins of lower extremity, in contrast to venous thrombosis, in which mostly the deep veins are involved. So that's why they are called as DVT. It is predisposed by increased venous pressure, as in pregnancy, thrombophlebitis, and prolonged standing. So occupations with prolonged standing are at a greater risk for developing varicose veins, or if someone is at the risk of developing varicose veins, so that person should have an adjustment in his or her job if that requires prolonged standing, or an adjustment in the ergonomics. So you can see here, this is a normal vein. Now this is the valve, and this is not tortuous, but if you look at this vessel, this is very tortuous, and there is a deformed valve which results in backflow, and you can also see it superficially because of bulging in the skin and that purplish discoloration or bluish discoloration as well. Now, let's talk about the tumors of the blood vessels. Now, there are two types of tumors that can be found in the blood vessels. They can be either benign or they can either be malignant. So let's start off with the benign tumors. So they are not true neoplasms, but they are better characterized as malformations or hematomas. So first of all, we have the spider telangiectasia, in which there is a dilated small vessel surrounded by radiating fine channels, just like a spider web. So here in this picture, you can appreciate the morphology or appearance of spider telangiectasia. Now, the second one is the hereditary hemorrhagic telangiectasia, in which it is an autosomal dominant condition, and it is characterized by localized dilation and convolution of venules and capillaries of skin and mucosal membranes. That is why this you can see this characteristic appearance of this telangiectasia. And secondarily, it is also complicated by epistaxis, which is the bleeding from the nose, and gastrointestinal bleeding as well. Other benign tumors of the blood vessels include hemangioma, which is also known as angioma. It is a malformation of a larger vessel composed of masses of channels which are filled with blood. And it is the most common tumor of infancy, and it is also known as port wine stain birthmarks. As you can see in this picture, this is a characteristic appearance of a hemangioma. Now, there are two types of hemangioma: capillary hemangioma or a cavernous hemangioma. In a capillary hemangioma, it is actually a tangle of closely packed capillary-like channels that may occur in skin or subcutaneous tissue, lips, liver, spleen, or kidneys. And in cavernous hemangioma, there are large cavernous vascular spaces in the skin and mucosal surfaces or in an internal organ as well. Now, moving on, we have the glomangioma, which is a small purplish painful subungual nodule in a finger or a toe. And then we have the cystic hygroma, which is a cavernous lymphangioma, most often in neck or axilla, and this is a characteristic appearance of a cystic hygroma. Now, moving on to malignant tumors of blood vessels, they are comparatively very much uncommon. And first of all, we have the hemangioendothelioma. It is actually a tumor of the endothelium, and it is intermediate in behavior between the benign and malignant tumor, not truly characteristics of the benign and not truly characteristics of the malignant tumor as well. On the other hand, we have the hemangioparasitoma, which is a tumor of the parasite cell. Now, what is parasite? Parasite is actually contractile cells surrounding the capillaries, and thus they can alter the lumen of the these capillaries or blood vessels by contracting. So hemangioparasitoma arises from parasites and varies from benign to malignant and behavior as well. Moving on, we have the hemangiosarcoma, which is a true malignant tumor, but it is very rare, and it occurs in the skin or the musculoskeletal system or the breast or the liver as well. And it is associated with toxic exposures to either arsenic or compounds like thorium dioxide, which is used in different type of radiographic diagnostic procedures. It can also be due to polyvinyl chloride, which can result in the angiosarcoma of the liver characteristically. We have another type of malignant tumor, which is known as the Kaposi sarcoma. It is also a malignant vascular tumor that occurs in several forms, such as classic, endemic, and epidemic. So the classic affects older men of Jewish or Mediterranean origin. Endemic tends to affect younger African men and children, and epidemic is actually a component of acquired immunodeficiency syndrome, also known as AIDS, especially in homosexual male risk groups. So this is actually a characteristic appearance or feature of a Kaposi sarcoma in this patient, as you can see. So in this part of the lecture, we talked about the venous disorders and the tumors of the blood vessels, both benign tumors and the malignant tumors. So we have two more parts of this lecture, so stay tuned. I hope you will learn more, and keep on visiting scadia.com. Thank you very much.